Breast size is important to many women. A woman with small breasts or whose breast size has diminished may desire an increase in the projection and fullness of the breasts to improve the balance in her figure and to enhance self-image and confidence. Breast augmentation is plastic surgery that increases breast size and enhances breast shape through the surgical placement of breast implants. In many cases, women who undergo breast augmentation do so to enhance small breast size or to restore breast volume that can diminish following pregnancy or weight loss. Breast augmentation does not correct severely drooping breasts. If you want your breasts to look fuller and to be lifted due to sagging, a breast lift may be required in conjunction with breast augmentation. Breast lifting can often be done at the same time as your augmentation, or may require a separate operation. Your plastic surgeon will assist you in making this decision. Breast augmentation can also achieve symmetry in breasts that are moderately disproportionate or with a difference in size. This program presents an overview of breast augmentation, the surgical placement of breast implants. It is not a substitute for a complete consultation with a plastic surgeon certified by the American Board of Plastic Surgery or the Royal College of Physicians and Surgeons of Canada. Breast augmentation is a very personal procedure, and you should do it for yourself, not for someone else. Breast augmentation with implants currently is the most effective way to achieve breast enhancement. Adult women of any age make good candidates for breast augmentation. However, it is recommended that a woman's breasts be fully developed prior to breast augmentation. Good candidates for breast augmentation are also healthy individuals who do not have life-threatening illnesses or medical conditions that can impair healing. A consultation with a board-certified plastic surgeon, a member of the American Society of Plastic Surgeons, is the first step to learn how breast augmentation can enhance breast appearance and improve your body image. The consultation is designed to fully educate you about breast augmentation with a discussion of your goals, the options available, the likely outcomes, and any potential risks and complications. Your surgeon will also describe the course of treatment recommended for you and answer your questions. During a consultation, you will be asked to share your expectations for breast augmentation and your personal health history. Full disclosure of your health history is important to your safety. This includes any history of breast cancer in your family and your personal breast health. You must also be candid about current medications you may be taking, the use of vitamins or herbal supplements, and alcohol, tobacco, and drug use. Your surgeon may ask that you get a preliminary blood test and take certain medications or adjust your current medications. You will also be asked to stop smoking and avoid taking aspirin and certain anti-inflammatory drugs as they can increase bleeding. By making the decision to consult with a board-certified plastic surgeon and following all of the instructions you are given, you are taking an important step in helping to assure your safety. A board-certified plastic surgeon is a physician who is properly trained in plastic surgery of the face and entire body. Prior to your procedure, you will be asked to sign informed consent documents. These documents assure your plastic surgeon that you fully understand the procedure you will undergo and potential risks and complications. In addition, you must commit to precisely following all of the instructions you are given. Instructions include pre-surgical considerations, such as testing and medications, day of surgery instructions, and medications and specific information related to the use of anesthesia. Your plastic surgeon will also examine and measure your breasts, including detailed measurements of their size and shape, skin quality, and placement of your nipples and areolas. Photographs may also be taken to document your breast's appearance. Breast augmentation is generally performed on an outpatient basis in an office-based surgical facility, an ambulatory surgical center, or hospital setting. Members of the American Society of Plastic Surgeons are required to use only accredited surgical facilities. Local anesthesia with sedation or general anesthesia is required. Medications are administered for your comfort during the surgical procedure. The choices include intravenous sedation and general anesthesia. Your surgeon will recommend the best choice for you. Breast augmentation enhances breast size and shape by surgically placing a breast implant into the body through an inframammary incision near the breast crease, through a periareolar incision at the edge of the pigmented skin surrounding the nipple, or through an axillary incision in the underarm area. Incision patterns vary based on the type of implant, degree of enlargement desired, patient anatomy, and patient and surgeon preference. Through the incision, a pocket is created in which to place the breast implant. This pocket is located either directly behind the breast tissue, called submammary or subglandular placement, or beneath the pectoral muscle and on top of the chest wall, called submuscular placement. Once the implant is positioned, incisions are closed with layered absorbable sutures in the breast tissue and with sutures, skin adhesives, or surgical tape closing the incision on the skin surface. A breast implant is a medical device, a medical-grade biocompatible textured or smooth silicone shell filled with sterile saline solution or silicone gel. Should the implant rupture or you suspect that it is leaking, it's important that you contact your plastic surgeon as soon as possible. Saline-filled implants may be pre-filled prior to placement or slowly filled at the time of surgery through a self-sealing valve. You must be 18 years of age to receive saline implants. Silicone implants are pre-filled and require that you are at least 22 years of age. Your plastic surgeon will also give you options for the shape of implant you desire. Form-stable implants are sometimes referred to as gummy bear implants and have a thicker consistency of silicone gel, which means they are less likely to break or rupture. Form-stable implants are also not round and may be shaped. These implants also require a larger incision than standard silicone or saline implants. Round implants can make the breasts appear fuller and provide a better lift. Higher profile options can achieve even more projection. Because round implants are the same shape all over, there is less concern about them rotating out of place. There are also options for breast implant surface texture. Smooth breast implants are the softest feeling. These implants can move within the breast implant pocket, which may give more natural movement. These implants may have some palpable or visible rippling. Textured breast implants develop scar tissue to stick to the implant, making them less likely to move around inside of the breast and be repositioned. Texturing offers some advantage in diminishing the risk of a tight scar capsule. Implant type, placement, size, and the incision pattern used in breast augmentation will be determined based on your breast anatomy and body type, your desired enhancement in breast size, and your plastic surgeon's surgical judgment. Implant manufacturers occasionally introduce new styles and types of implants. There may be additional options available to you. Saline and silicone-filled breast implants are medical devices approved by the U.S. FDA for safety and do not impair breast health. Careful review of scientific research by independent groups such as the National Academy of Sciences Institutes of Medicine have found no proven link between breast implants and autoimmune or other systemic diseases in women. In addition, breast augmentation with breast implants does not generally interfere with a woman's ability to breastfeed. In general, complications from plastic surgery of the breast include bleeding, poor healing at the incision sites, thick discolored or raised scars, changes in nipple sensation, and infection. There could also be anesthesia side effects or pain in surgically treated areas. Women who smoke are at increased risk of poor healing and are therefore advised to stop smoking for several weeks before and after surgery. In addition, breast augmentation may result in visible wrinkling of the skin over the implant, or the development of a condition called capsular contracture. Capsular contracture causes the naturally forming scar tissue around a breast implant to contract. This occurs in a variable percentage of patients and can make the breast feel firmer than normal. The condition can be addressed and sometimes requires revisional surgery, although correction is not always permanent. You should also understand that breast implants are not guaranteed to be lifetime devices. Implants can leak or rupture, and future surgery will likely be required to replace one or both implants. Immediately following your breast augmentation surgery, dressings or bandages may be applied to your incisions, and an elastic bandage or support bra will minimize swelling and support the breasts as they heal. Breast augmentation requires regular examinations of your breast's health and to evaluate the condition of your implants by your plastic surgeon. Before being released, you and an accompanying family member, friend, or caregiver will be given specific instructions that may include how to care for the breast following surgery, medications to apply to aid healing and reduce the risk of infection, specific changes to watch for at the surgical site, or overall health and when to follow up with your plastic surgeon. You will also be given specific information identifying the manufacturer, style, and serial number of the breast implants placed during your breast augmentation for your record and as part of the breast implant manufacturer's warranty. In general, your recovery from plastic surgery of the breast may include swelling and discomfort at the incision sites and in breast tissue overall. Discomfort is common and can be controlled with medication. You should begin light walking as soon as possible following your breast surgery. In addition, a support bra may be recommended for the first week or two following breast surgery. It will be important to cleanse the incision sites and apply ointment as directed. Be sure to follow all instructions carefully. Initial wound healing may take 1 to 2 weeks. Sutures will then be removed if necessary. The initial results of breast augmentation are visible immediately. You should be ready to return to work or normal activity within a week following breast augmentation, but do not engage in any heavy lifting or vigorous exercise until your plastic surgeon gives you clearance to do so. Intimate contact with the breast and more vigorous exercise may resume when healing is more fully completed, usually within 4 to 6 weeks following breast augmentation surgery. Healing will continue for several weeks as swelling resolves and the implant settles. Your incision lines will continue to fade over the next year or more. Even though incisions are placed inconspicuously, incision lines will result in permanent scars. Pregnancy, weight loss, and menopause may influence the appearance of augmented breasts over the course of your lifetime. Additionally, you should continue receiving normal mammogram examinations after your breast augmentation. These exams can be performed with the presence of implants and are crucial to maintaining breast health. Mammograms will not harm your breast implants. Breast augmentation is a highly satisfying plastic surgery procedure to enhance the size and shape of a woman's breasts. Your new enhanced breast size and body contour will give you the confidence and freedom to wear certain clothing styles without the need for padded bras and bring added self-confidence, whether at the beach or in the boardroom. Choosing to undergo breast augmentation or any plastic surgery procedure, whether cosmetic or reconstructive, is an important decision, and so is selecting a plastic surgeon. Be sure to ask your plastic surgeon questions. It's very important to understand all aspects of your breast augmentation surgery. It's natural to feel some anxiety, whether it's excitement for your anticipated new look or a bit of preoperative stress. Don't be shy about discussing these feelings with your plastic surgeon. Over time, your breasts can change due to aging, weight fluctuations, hormonal factors, and gravity. If after a period of years you become dissatisfied with the appearance of your breasts, you may choose to undergo a breast lift or implant exchange to restore a more youthful contour. Prices for breast augmentation can vary. The cost of the surgery may be based on the surgeon's experience, the type of breast implant used, and geographic location. Be sure to ask your plastic surgeon what patient financing plans they offer. Costs for breast augmentation surgery include hospital and surgical fees, medical tests, medication prescriptions, and surgeon fees. When choosing a plastic surgeon for a breast augmentation, remember that the surgeon's experience and your comfort with him or her are just as important as the final cost of the surgery. The American Society of Plastic Surgeons has prepared this educational program to supplement your personal consultation with a plastic surgeon who is certified by the American Board of Plastic Surgery or the Royal College of Physicians and Surgeons of Canada. Plastic surgeons with this certification have completed approved surgical training and rigorous examinations in plastic surgery, including both cosmetic and reconstructive procedures of the face and entire body.